Triple-negative breast cancer constitutes about a fifth of all breast cancers that we see. And historically, it has been associated with a really terrible prognosis. It tends to affect younger women, African Americans, people with BRCA1 or 2 gene mutations. And the issue is that because it's triple negative and lacks receptors for estrogen, progesterone, and HER2, we don't have targeted therapies. So when we think about current approaches, we really need to think about where can we move in triple-negative breast cancer to make an impact for our patients. We know that triple-negative breast cancers actually respond really well to neoadjuvant chemotherapy. And so there have been a number of trials looking at novel agents to see whether we can find agents that work particularly well in this subset of patients. So for example, platinum-based agents seem to work really well in triple-negative breast cancer. We don't know whether that's because it's more often found in BRCA-positive patients. But the other thing about triple-negative breast cancer is that they tend to have a higher rate of tumor-infiltrating lymphocytes. And so, with the current era looking at immunotherapy, this is potentially a really exciting target. There are now some clinical trials that have shown that immunotherapy works really well in heavily pretreated patients who have metastatic triple-negative breast cancer. And now there are clinical trials, including one going on at Yale, looking at immunotherapy in the neoadjuvant setting in earlier stage patients. And I think that this potentially has the potential to really change management for these patients.